station is the exit interview station, and this is where the clinician, which is usually a nurse, doctor, dietitian, or pharmacist, provides consultation to each individual based on what their results are and comparing it to what we consider normal or recommended values. So the tools that we have available at this station are for the exit interviewer's disposal. Nursing students are allowed, or students are allowed, nursing or medical students are allowed to be at this particular station and provide consultation as long as there is a faculty there with the student. So in other words, they can do it in tandem as long as it's sort of a joint process between the two of them. So just wanted to explain that before I proceed further. So at this station, the participant will come and bring their paperwork with them, which is just this one form. What the exit interviewer is going to do is review the results, and we're going to have what we call the explanation of your results form available. And each participant gets one copy of this form, but the exit interviewer or the clinician uses this form as kind of a talking tool or way to educate the participant about what their values look like in relationship to these recommendations here. So that's the first and most major piece at this particular station. Next, what the exit interviewer does is remove the carbon copy from the original. So they're going to just separate these two. The exit interviewer, the clinician, is going to keep the white copy. They're going to hold on to it in a pile here. This yellow copy is the participant copy. So they can take this onto their and show this to their primary care physicians, especially in the case if there is some sort of warning sign or red flag in any of these values. So this is their copy that they can take to show to their providers for further follow-up. If the person or if the participant is somebody maybe who doesn't speak English well, or maybe is elderly and might need assistance explaining what this form means to the physician or primary care provider, we have this letter that also goes along with the form. And this letter basically says that this particular person came to the National Kidney Foundation screening, and these are some results that we would like you to review. So it basically explains it for them. So as long as the participant brings this yellow copy and this form together, the physician can follow up further. Other tools that are provided at this particular station is a BMI chart. So the clinician can look at the participant's weight and height and calculate the individual's BMI, or give an estimated BMI based on this chart. And we also have what we often like to use as a really good visual to talk about what GFR means, and it's this GFR scale here, and it shows the GFR in relationship to the stages of kidney disease. Again, we don't make any kind of diagnoses, but we do want to point out use this opportunity to educate people about what GFR is and what its relationship is to diabetes or blood sugar or hypertension or family history or the other values that they receive at the screening. So this is just a really good visual that we give folks, and it also has a listing of the Kidney Foundation programs on the back. So that's another piece. Another item that we have is a list of affordable community health centers or clinics for those who don't have insurance and might have come to our screening but need follow-up. So this list provides them a resource to call different places to see if they can hook up for affordable care. So we usually have, depending on what island we're at, we have a list of locations where they can possibly go for affordable help. Then we also have a follow-up program that's called KIWI. So each screening that we conduct in different parts of the state is followed by a program which is affectionately named KIWI, and KIWI stands for Kidney Interactive Workshops and Information. And it's a 4-part course that basically educates the individual about diet, exercise, and ways to prevent kidney disease. People who have warning signs or maybe abnormal values at our screenings are identified, and we send them an invitation to come to this particular event. And again, it's usually held sometimes in the exact same place as the screening, but at the very least in the same community as the screening. So this is available as well. And then the last thing is we have a range of brochures that we give people if they need to just read up on certain conditions or learn more about some risk factors or kidney disease itself. So these are the tools that are provided at exit interview. Another thing that we want to do at this station is just to thank the participant and ask them if they have any further questions, and give them the Kidney Foundation number as well if they need to follow up with us about their results or anything regarding the screening at all. And that's it. That's all for the screening. On behalf of the National Kidney Foundation of Hawaii, we just really want to thank you for your help and your enthusiasm and participation in our events, because really, truly, we're not able to do these events without help from volunteers. As I mentioned earlier, these screenings are totally staffed by volunteers with the exception of maybe 2 to 3 staff members from the Kidney Foundation. So again, we just really want to thank you, and we look forward to working with you. And if you have any questions, please don't hesitate to call me or any of the staff at the Kidney Foundation, but you can reach us at our website, or you can look for our information on the website at www.kidneyhi.org, or you can email me or give me a call at jill@kidneyhi.org, or my office number is 589-5903. So again, that number is 589-5903.